Namaskar, friends. Medical model of today. See, an elephant is being described by five blind people. So, what happens? Each one will only feel one particular part and tell. Similarly, nowadays, if somebody is diabetic, the doctor only focuses more on diabetes. Other things are not being done. Let us check. There are 13 compartments, I say. What are the 13 compartments? And there are 16 blood tests, which will give a comprehensive health score analysis. Let's look at them. What are they? Friends, suppose there is some smoke coming from your house. So when you check the hall, and suppose there is some fire, you douse it. Similarly, you must inspect all your rooms. Then only you will be able to know that everything is perfect. Similarly, let's look at what are those 13 compartments. First compartment is diabetes. See, fasting insulin is one key blood test which should be around 3 to 6, but the lab says 3 to 25. And I happen to meet a person who is a female, 28 years, 70 kg overweight, 5 feet 5 inches. And when I learned that she was diabetic, she was getting the blood test done. I have suggested her to take fasting insulin, C peptide also. When she has done the fasting insulin, look at the level. It is 32.58, way high. The range lab says 3 to 25, but ideal is 3 to 6. That means he is almost about 6 to 7 times higher. Fasting blood glucose is way high, 201. She was diagnosed diabetes and she came to check in this lab again. Look at her HbA1c is 9.4%. At the age of 20, she's a full-blown diabetic. The ideal range is 4.6% to 5.6%. The ideal should be the minimum range, 4.6, below 5% is the best HbA1c. Now, now let's look at the second one, lipid profile, triglycerides to HDL ratio. Triglycerides is way high. Good cholesterol is very low. It's 14. It should be above 60. Next is D vitamin and B12 vitamin levels. So D vitamin she checked, it was 9.19. The ideal range lab says 30 to 100, but the best is 50 to 100. Preferably be 70, 80, 90 would be the ideal. B12 she has not got it checked. Insulin resistance is a calculation, friends. It should be fasting glucose multiplied by fasting insulin divided by 405. The value should be below 1.5. Look at her level is 16.17. That means almost 9 to 10 times higher. Severe insulin resistance. Severe insulin resistance, we'll see what all it can cause. Then comes weight and waist size. Weight should be as per height. As per 5 feet 5 inches, she should be around 60 kg, but she is 10 kg overweight. Waist size should be half of height in inches. It should be 33, but her waist size is higher. BP is normal and no medicine she is taking. Luckily, at the age 20, out of 10 parameters, only she got checked 9. Out of 9, only 2 are okay. That means her health score is 22%. Friends, see what are the problems she has. She has severe insulin resistance. She's full-blown diabetes, dyslipidemia, and lipids are not good, low D vitamin, overweight, and also I've checked her fatty liver was very high. The ALT enzyme is very high. It's above 40, 50. Now, friends, what is this insulin resistance? We have just seen fasting glucose multiplied by fasting insulin divided by 405. The value should be below 1.5. If it is below 1.5, insulin sensitive. Above 1.5, insulin resistance. But it is at 16.17. The first time I'm seeing anybody having such a huge high insulin resistance. What all insulin resistance can cause? Belly fat, overweight, high cholesterol. She has all this problem, fatty liver, PCOD problem, high blood pressure, dementia, heart problem, and diabetes. Diabetes is a problem which happens at a very later stage. I was trying to inquire her what is the reason for her ill health, and I came to know that she takes lot of cool drinks in the day, throughout the day. She probably keeps sipping the drink for multiple times in a day. The whole problem of this insulin resistance is eating multiple times in a day. breakfast, lunch, and dinner, coffee, tea, snacks, cool drinks, and all. In a day from morning wake up to night sleep, people are eating 6 to 7 times. That way, for in 5 to 10 years, people will develop insulin resistance. Let's see, look at the other, these are the six blood tests which will give you overall health. The six tests and these four other parameters, we'll talk about 10 parameter health score. Out of 10 parameters, you see where you are. Now let's look at the 10 additional blood tests. This is the 10 additional blood tests. Of course, this report is not belongs to that girl, some other person. For educational purpose, I am trying to show. What are they? Liver test. Liver test should be, the enzyme should be 10 to 35. This person is 44. Thyroid profile is 1.8 to 3. It is 3.36. Then hemoglobin, complete blood count. There are so many other parameters. I'm not a doctor. I'm not trying to comprehensively assess. Just know about your hemoglobin and iron and all that. That would be sufficient to some extent. Urine routine should be all right as per lab reference. Then these are the inflammation markers. Uric acid, high sensitive C-reactive protein, homocysteine. This also should be 5 to 15. These are the inflammation markers. If somebody wants to know how is their pancreas functioning, is it 2 hours PP insulin, 2 hours PP sugar to be done. After taking 75 grams of glucose powder, if after 1 hour the insulin should be below 60, after 2 hours it should come back to below 30. This gentleman was having after 1 hour 180, after 2 hours 83, way high. 2 hours sugar level 150 to 190, the sugar levels are all right. Creatinine, this should be 0.7 to 1.3. 1.03 is there. Friends, creatinine kidney function will be all right for many, many years. Similarly, fasting sugar also. So a lot of times, everybody gets their creatinine first. Friends, when there is a floods, only first the ground floor, car parking will be inundated with water, not the first and second floor. Creatinine is something like a second floor. If the water is reaching up to second floor, that means you are sunk. That's the level. But people are checking in the first place itself creatinine and are not checking fasting insulin. Now there are two, the BMI, total cholesterol. These are the 16 blood tests. Once you do this, friends, you'll be able to comprehensively understand your health. So please check your health score. Check these 16 parameters. The six parameters would be reasonably sufficient for people who are not having much health problem. But otherwise, I advocate everybody who is overweight, who has large belly size, who is taking any medication, must get the 16 blood test. Thank you very much for listening, friends. Knowledge and discipline are the gateways to your health. You must invest time to acquire the right knowledge. Once you know what is your health score, now you see the person who has 22% health score, what needs to be done? They have to be more disciplined. Understand this. If anybody is interested, you can join my wellness secrets group. You can learn these things so that you can improve your health. Thank you very much for listening. And if you like this video, please subscribe and share. Thank you very much.